My name is Callan Monette, and I'm a bioengineering PhD candidate in Dr. Fan Yang's lab at Stanford University. Our lab specializes in biomaterials and bone tissue engineering, and my project aims to apply those tools in a new way. Osteosarcoma is a rare and aggressive primary bone cancer that primarily impacts children and adolescents. While it's most commonly treated using a combination of chemotherapy drugs and surgery, patients often develop drug resistance and metastasis. Due to those challenges, there's been very little improvement in patient outcomes in the past 40 years. In order to better understand and treat osteosarcoma, there exists a real need for a reliable experimental model that allows us to both study the biology of the cancer and to screen potential treatments. Currently, osteosarcoma is most often studied in one of two contexts. 2D culture, growing cells flat on the surface of a petri dish, allows us to quickly and cheaply grow millions of cells. However, cells often behave very differently when grown in 2D due to differences in their surrounding environment and cell-cell communication, and may respond to drugs differently than in a human tumor. In contrast, in vivo models offer a much more physiologically relevant environment and have been shown to more accurately predict drug responses in humans. However, growing tumors in mice is time and cost intensive, making it a less scalable choice for testing many potential therapies. Using biomaterials, we're able to balance the need for scalability with physiological relevance by creating a three-dimensional environment where we can seed patient-derived cancer cells. We can mimic some of the critical niche cues that lead to more accurate drug response than 2D, but we're also able to conduct relatively larger scale studies more quickly and cheaply than we could with mice. My work asks the question, how do different 3D model features impact osteosarcoma cell behavior and drug response? I'm working with a variety of 3D scaffold-based platforms with different material properties to learn what features best capture key osteosarcoma cell behaviors. I'm interested in characterizing how patient-derived cancer cells in each of these environments display key hallmarks of cancer cell behavior, including proliferation, cell matrix interaction, key genetic pathway upregulation, and drug response. So far, I've been able to show that different 3D models show different levels of key features, such as chemotherapy resistance and expression of key osteosarcoma gene pathways. My hope is that this work will allow us to create more effective 3D models, which will allow us to both understand the biology of osteosarcoma and screen the therapeutics for osteosarcoma more effectively and efficiently. As I continue moving forward on this project, I really appreciate the support provided by the ARCS Fellowship, which allows me the opportunity to study a relatively rare pediatric cancer and hopefully contribute to improving patient outcomes in the next decade.